one is the evolution of the health system. Second one is the way the system has evolved over time. What have been the major problems? And I think third one is the issue of health insurance, health financing, particularly health insurance. So I don't know how much time I will have, but I think
we'll come around several times.
Okay,
but,
I want to
5 minutes in the round.
Yes, I think it's good to look at the evolution very clearly first. And then we talk about the problems and focus on the health insurance.
Sure.
So if you permit me to go along that way.
Please, go ahead.
Okay. Now, I like talking about the evolution of the health policy and health systems development in Nigeria. And from my own perspective, I think there are 6 phases that I have observed. The first one is during the colonial period. Due respect to Baba, Professor Ogunlesi, and I doff my cap to you, sir. You will remain great by the grace of God. During the colonial period part, we know that the system was delivering curative hospital services. And these were largely for senior public servants and government workers. And the public health activities were mainly focused on environmental health and vaccination. And they were concentrated in urban areas. And therefore, there was very limited access to the general population except where mission facilities existed. In my area, we happened to have, it was then SIM Hospital, Egbe, which was very famous in those days. That was the only hospital that was available to us in that area. So that was the kind of thing we had up to the time of independence. Now, phase 2 was the period I call the National Economic Development Planning era. And this spanned the period of 1962 to 1985. And this is broken into 4 or 5 sub-phases. The first one was the first National Development Plan period, 1962-68. That was the first indigenous plan that we developed. And of course, in developing the plan, particular attention was paid to prevailing health problems, and therefore the plan aimed at addressing those health problems. Emphasis was on health manpower development and building health facilities. And the focus of health services delivery was still curative rather than preventive, and it was urban biased rather than rural. The second subphase of this National Economic Development Plan era was during the second National Development Plan period, 70 to 75. Now, again, the plan aimed at improving prevailing health problems. And, we had the Civil War. We ended the Civil War at that time. And restoring, rehabilitating health facilities that were destroyed during the war. A priority was also given to environmental sanitation, but added to it was the training of medical and health personnel. The third subphase was during the third National Development Plan period, 75 to 80. That period marked the initiation of health system development, with primary health care as a cornerstone. And I think the major initiative at that time, at that period, was the basic health services scheme, which was introduced to increase access to services and correct the imbalances between curative, preventive, as well as urban-rural area bias. You will recall that Professor Ransom Kuti of blessed memory was appointed as the director of this program.
Yes.
And it was really an attempt to increase access. And the BHSS, that's the Basic Health Services Scheme, was based on the concept of a BHU. BHU is a basic health unit, which was aimed or which was planned for an LGA with a population of 150,000. And for each LGA, the plan was that you will have the following facilities.
In fact, just not to interrupt you, but we plan a special session on primary health care because it's something very, very dear to my heart personally. And I have some ideas of, how local governments can focus on.
Yeah, I'll be interested in participating in that also.
All right, great.
But let me just run through this overview. Yes. It was to every local government of 150,000 was to have a comprehensive health center, 4 primary health care centers, 20 primary health care clinics, and 5 mobile clinics. Now, and then the health workers, they introduced new cadres of health workers, and these were to be trained in schools of health technology, and the CHOs, that's the community health officers, were supposed to be trained in teaching hospitals. Now, I have a lot to say on this because I was part of the program. That program failed. And even at inception, when I was invited by Professor Kuti, I told him that I know this project will fail. He asked me why, and I told him why. And I turned out to be right. Number one, just to mention, and I think I'll elaborate on this when we are discussing primary health care, is that attention was largely on, facilities, health workers. They were to be very numerous but more importantly is when I costed what we need to be able to put this in various local governments in Nigeria, I saw that it was not affordable, given our level of resources at that time. The last, during the planning era, was in 1980 to 85. Again, that failed. Now, so really, let me go to third phase. That was the first serious effort of health policy and health systems development. And that was 1985 to 1992. Coincidentally, it was during the time that Professor Ransom Kuti became minister. And a number of things happened. He tried to implement PHC based on the Alma Ata Declaration. Did so many things, which I will say for now, for when we are going to discuss primary health care. But what then happened was that at the end of that, I was then in WHO, I remember, he was so proud of his achievement that in 1991, he wrote to WHO to please come and evaluate the progress we have made in Nigeria. And I was part of the people providing technical support to the team, high-level team. Members were drawn from all over the world. And the report at the end of the review was that Nigeria had done very well, with respect to primary health care. We got a pat on the back. And indeed, the review team said, look, you need to institutionalize the implementation of primary health care. And that was what led to the establishment of the National Primary Health Care Development Agency. Now, one of the key achievements at that time was the 80% immunization coverage that we were able to achieve. That was up to the 1992 when he ended the tenure. After 1992, we entered another phase, which was phase 4. And that was when the PHC, what he built, totally collapsed. And I'm not sure we have been able to rebuild that. When we're discussing that primary health care, I'll be able to adduce reasons why this fails. Now I go to phase 5. I'm almost nearing the end of this. It was the second serious effort at developing, health policy development as well as health systems development. I would say that was the period 1999 to 2007. You had return to civilian government. You had the enactment of the NHIS decree shortly before. It was in May 1999 that the decree was enacted on NHIS. We'll come to that later. And then, of course, so many things took place. Our health sector reform agenda, which, in all modesty, I think achieved the purpose for which, we designed and implemented it. And a number of things happened. Financing by government increased. And when government increased its financing to health, the partners, increased their financing too. I remember the federal government financing of health increased by almost 150% between 2003 to 2007. And the donors almost tripled their investment. DFID particularly, their portfolio almost tripled because I was working with them before I became minister. So some progress were achieved at that time. And of course, the last era is from 2007 up till now. But ladies and gentlemen, all these efforts have been made, but we still have big problems. We still have very weak, ineffective national health system.